Now take a look at this statement from Scotland's First Minister, Nicola Sturgeon.
If the surge continues and if it accelerates and if we start to see evidence of a substantial increase in serious illness as a result, we cannot completely rule out having to reimpose some restrictions.
Now, get used to that messaging, not just north of the border, but across the UK. The siren voices for lockdowns and other COVID measures will get louder. The arrival of more ruinous measures this side of Christmas is more likely than the arrival of Santa Claus himself. Have we learnt nothing? The aim of lockdown was supposed to be to protect the vulnerable, but with one of the highest COVID death tolls in the world, protect them, we did not. Curfews, social distancing, arrows in supermarkets, there is no overwhelming evidence that they really helped, but their overwhelming damage is clear. In terms of the effectiveness of lockdowns, for example, Professor Simon Wood ran the figures for all 3 national lockdowns in a peer-reviewed study. His figures suggest fatal COVID infections were falling before each lockdown was imposed. And the graph of infections for countries that locked down hard and those that didn't looks strangely cinema. Turns out, virus gonna virus. Now, I will cut the authorities some slack that in March 2020, with little known about the virus, who could blame them for wanting to do something? Now, I sincerely hope that these measures were the right thing to do, but I've got my doubts. And we now have a cost-benefit analysis of lockdowns after the fact, something, of course, that should have been done at the beginning. And what have we got? Well, we've been left with a poorer, sicker, sadder and more divided country. Take the NHS waiting list, which is now in excess of 12 million people. Explain to me how that's not going to cost more lives. Plus the damage to life and loss of life caused by the biggest recession in 300 years. £1 trillion worth of extra debt by the time we're done with this, a smaller economy, a mental health crisis and our kids' education in chaos. So you want more of that, do you? Sorry, I'm not having it. I was described by the Guardian newspaper yesterday as a lockdown sceptic broadcaster. Too right I am. Why isn't everyone sceptical after all this damage for so little reward? To all of those lockdown fanatics, perhaps many of whom could afford it, or others bought off by the furlough scheme, sat at home in their lovely houses, baking banana bread, listening to podcasts, and pouring themselves a large glass of Pinot Grigio for their final Zoom session of the day. I say spare a thought for the millions of people whose lives have been wrecked by these measures, and for the victims of the non-COVID death toll that no one talks about, which will, of course, likely dwarf that of COVID in the months and years to come. The University of Bristol have estimated an extra 500,000 premature deaths as a result of lockdowns. And of course, once viable businesses were closed down, the self-employed were effectively disowned by the Treasury. And the elderly and vulnerable themselves have been imprisoned in their own homes since March 2020. So when are we going to have a grown-up conversation about whether lockdowns and other COVID measures actually work and the price they exact before we sign up for more? Why do we ignore the elephants in the room of Sweden, Florida and Texas? Florida's a great example. An older, more vulnerable population and with more densely populated cities than lockdown-loving California, and yet a comparable death toll. Cases fell when Florida and Texas lifted measures in a move described by President Biden as Neanderthal thinking. I'm so confused. In fact, show me any country in the world that didn't or couldn't lock down that has a cricket score death toll. There isn't one. Some of the strictest lockdown regimes are at the top of the unfortunate COVID league table. Even the basket case example of India, with its disastrous healthcare system, a third of its population with metabolic syndrome, and of course those horrific scenes played out of people literally dying outside hospitals, contradicts the cosy COVID consensus. India weren't able to pay for people to stay at home and make their way through the Netflix back catalogue. After a painful spike reported enthusiastically across the media, cases in India fell off a cliff, and they now have a significantly lower per capita COVID death rate than us. And you can't really use the population density argument in cities like Mumbai or in a country with a population in India of 1.3 billion. So why doesn't data matter anymore? Why don't facts matter? Still, the masked militia push their woke agenda of face coverings. If they worked, why have we had so many cases? SAGE subgroup member Professor Clifford Stott says face masks are now more of a political statement than a help to public health. Professor Carl Hennigan of Oxford University said that masks are not evidence-based. And former SAGE advisor Professor Colin Axon told Dan Wootton on this very programme that masks are merely comfort blankets with any benefits too small to be measured. Wow. But of course, facts don't matter anymore, and harms are ignored. Does no one care about the psychological impact of things like masks? The pollution from chucking away 53 million of them a day? And what about the potential impact on your actual health? Is it optimum for human health to cover your nose and mouth for hours on end? When I watched supermarket workers and restaurant staff huffing and puffing through a 12-hour shift with a face covering, it struck me as cruel and wrong. Interesting how many of those heroes that served us during the pandemic have since chosen to discard their face coverings. And many in the so-called vulnerable groups are now mask-free, suggesting common sense is beginning to prevail. Now, by all means, wear a face mask forever if you like. But the ability to choose all of these things is now a test case for the future of this country. You see, I like measures that actually work, like the vaccine. Seemingly, it's very helpful at preventing serious illness and death in the most vulnerable groups. And it's got my vote. I'm double jabbed. But it must be personal choice. So as we emerge from this pandemic, lessons have got to be learned and mistakes not repeated. The problem that we have is there's an entire generation of politicians who are hooked on the optics of being seen to do something. Masks and lockdowns and arrows in supermarkets isn't safety in my view. It's safety-ism. And of course, things like lockdowns and masks make sense on paper, which is what makes them so dangerous. A year and a half on, the numbers are coming in and it doesn't make for good reading. We've tried to stop the virus and I believe we have failed. We've been led by people looking out for their job, not for the public interest. It's been the world's first health and safety pandemic, a jobsworth's pandemic. Safety first at the expense of everything else. We've been led by public figures keen to be seen to do something and mindful of the judgment of history. Given the damage, there can be no future lockdowns, no jabs for kids, no mask mandates, and absolutely no COVID passports. The approach going forward must be based on freedom and individual judgment. Let us, as human beings, assess the dangers as we have done as a species for millennia. It's time for the state to butt out of our lives because, in my view, the damage from these COVID measures has been far greater than from the virus itself, nasty and highly infectious though it is. So here's my message to the fans of lockdown. You've had it your way for a year and a half. The damage has been colossal, the advantage is hard to see from where I'm standing. So now it's our turn. It's time for the British people to reclaim our country and our freedoms and judge the risks of life for ourselves and get back to normal.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.